My name is Jessica Andres Bergos. I'm originally from Spain, where I did my PhD. I came to the US 8 years ago, and I came here to do my postdoc. But very early on, I realized that the pipetting in the lab was just not for me. So I decided to change a little bit my career path and pursue something more oriented to clinical research and patient care and healthcare management. So I am the director for research and clinical operations for the Center for Regenerative Medicine at the Hospital for Special Surgery. And in my current role, I very much try to get together the clinical side of the research and the lab side of the research, because I have the feeling that there's still a lot of translational research that can be done, and the hospitals and healthcare settings, they just need to invest more and try to do more work about it. So in my role, we mainly focus on regenerative medicine procedures, and that's mostly cell therapy and trying to use the cells of our own body to repair and heal the body. Never felt that I was treated unfairly. In fact, I have to say that in clinical research, I do see way more female roles than male roles. If you look at the numbers in healthcare settings or biotech and in pharma companies, there's about 65% of female working for those companies. But I think the issue is when you look at the numbers closely, and especially if you look at the numbers for the C-level positions, is where you start to realize that there's still a lot of work needs to be done. I think for the C-level positions in general, women just make up for the 30% of those roles. And if you go to the CEO position, is barely a 10% female for healthcare companies, biotechs, or pharma companies. So if you look at the big picture, you realize that there's 65% of female working for those companies, but only 10% of the CEOs are female. There's obviously something that needs to be done. The first step to maintain work-life balance is wanting to maintain work-life balance. And I'm just saying that because when I first came to the US and I was a postdoc, I saw a lot of people around me that were doing really, really long hours in the lab. And we all know that that's kind of taken for granted, that you're gonna spend a lot of hours in the lab, but you need to be strict with yourself, and you really need to put passion in other things that are not your job. When I spoke to many of these people, they will tell you, no, but I love my job, so I just like being in the lab, and that's fantastic. And you definitely need passion for your job, but you need to split your passion with many other things, because otherwise you're just gonna lose that passion very early, and you're just gonna burn yourself out. So the first thing to maintain work-life balance is just be strict with yourself and try to do something else outside of your job. Either if you have family or you don't, you have friends, you just like to be by yourself, just spend your time however you want, but just do something besides your job. Something that I will say to my younger self will be try to learn more cross-functional skills. I have the feeling that in the US, the education system is a bit different, but in Europe, or especially where I come from, when we're in university, when we're in college, we're just told to specialize in a specific, very small field. And then you start to realize that you need a whole set of skills that have nothing to do with science in order to strive in your career, right? So right now, I'm just dealing with finance, I'm dealing with legal, I'm dealing with compliance, and I'm dealing with all these teams, even like marketing, and you need to put together some materials for advertisement or for patients. So definitely focus on what you like, but try to expand your skill set to many other things.